Hello students, I am Srishti Tiwari here. Today we are going to discuss about next environmental factor that contributes to our health, that is housing. What is housing? Housing is a human settlement where the human is used to get settled, and the definition has been given here, that is where the group of people or the individual used to get live in that place, and they used to achieve their goal of life, that is known as human settlement or the house. And the settlement will be, the size of the settlement will be the vary from this number of individual or the number of family members is being living in the house. Next definition we will see according to WHO. According to WHO, it is a residential environment where the people is used to live in that place, that is known as residential environment. And the definition has been given according to the WHO, that is a physical structure where the human or man used to get live, and the structure, that physical structure will include all the necessary services, facilities and equipments, and individual will whatever desire the individual will have, they will fulfill, like physical and mental health and the social well-being of the family and the individual will be the fulfill in that physical structure. So that is the definition is given by the WHO, that is known as housing. Next is social goal of housing. What is the social goal of housing? First one is shelter, second one is family life, third access of community facilities, fourth one is family participation in community life, fifth and last one is the economic stability. We will see one by one. Shelter means the house where the individual is living, that should provide a shelter, which is the basic need of the individual. And family life means the house should provide the adequate space for the family, means the whatever the things are being available in the house, that have the proper place at that, like the storage of food and the sleeping pattern and all, that has to follow the adequate spacing. If the adequate spacing will be there in the house, so that will leads to the family stability. And if the proper spacing is not being followed, that will leads to instability in the family. And access of community facilities means whatever facilities that we need in our life, that has to be accessible from the house. Like some facilities are like the community services and the health services, schools and the shopping areas and place of worship, etc., that has to be accessible from the house. Family participation and family participation in community lifetime. Family participation means family is a part of wider community. With the family is used to the we can say family is the unit of community. If they will live with the be feeling, or they will mingle with each other and they can help each other, and they will live as a friend. And the economic stability means the housing is a form of investment of the personal savings, means house will be formed by the personal savings of the individual or the person, and it's provide for the economic stability and the well-being of the family. So these all are the social goal of the housing. Next we will see some government role of the social goal in housing. So there are mainly three social goal. First one is introduced social housing scheme. The government role is the government has to introduce some scheme for the housing, and the government has to create some financial and physical institution, means if it will create by the government, it will help those who are earning low cost, so it will help that individual for building the house. and establish both minimum and maximum standard. So government has to establish some minimum and maximum standard that has to be followed while housing construction. Means minimum and maximum goal has to be according to the personal individual ability. Next we will see the criteria of healthful housing. We will discuss, that is, to prevent the spread of communicable diseases and to encourage personal and the community development. Healthful housing provides the physical protection and the shelter, to provide for protection from hazards of exposure to noise and pollution, to provide adequately for cooking, eating, washing and the excretory function. Last one is to free from unsafe physical arrangement and from toxic and harmful materials. So these all are criteria for healthful housing. Next we will see the housing standards. Means if the any individual is going to construct the house, so the house has to be constructed being following all these standards or criteria. We will see one by one. Site, setback, floor area, garbage and refuse, roof, walls, rooms, windows, kitchen, lighting, bathing and washing, privy, water supply and cubic space. So all these standard has to be followed while the housing construction. We will discuss means where the house site has to be. Site means the where the location of the house is to be. The location, the house should be elevated from the plain area. If the house is elevating from the plain area, it will prevent the flooding and it will prevent the water come into the house, and it has to be away from the breeding place of the mosquitoes and the flies, and it has to be placed in the pleasuring surroundings of the housing should be the pleasurable, and this whatever soil is there, that has to be dry and safe. Second one is setback. Setback means the open space all around the house. If the open space all around the house will be there, that will provide the proper lighting and the proper ventilation. That is known as the setback. And third one is floor. Floor has to be pakka, that will be easily washable. And that next one is the walls. Next one, walls. Walls also has to be pakka, and it has to be strong and it could not be easily damaged, and it should have the low capacity of absorbing heat. It should not get absorb the heat. And next one is roof. Roof, the height of the roof should not be less than 10 feet. The height of the roof should not be less than 10 feet. And next one is room. Next one, rooms. Means if any housing is going to be constructed, minimum 2 rooms should be there, and the number of room will be vary according to the number of according to the family members are living into the house. Next one is floor area. Next one is floor area. The floor area of the room should be the 120 square feet. That should be 120 square feet. Next one is the cubic space. Cubic space of the house should be 500 cubic feet. That should be 500 cubic feet. Next one is window. Next one is window. The 2 windows has to be there in the house, and it should not be placed at the height more than 3 feet. Window has not to be placed more than height 3 feet. And next one is lighting. There should be proper lighting and in the house. And next one is kitchen. Next one is kitchen. kitchen must be separate in the house, and there should be the proper water supply, and there should be the separate sinks and the proper drainage system of the water from the that kitchen should be there. And next one is the privy. Privy means there should be the proper water carrier system from the house. And next one is the garbage and refuse. Garbage and refuse, whatever the garbages and the refuse are being produced in the house, that has to be properly collected, and that has to be disposed of in the sanitary manner. Next one is bathing and washing. Bathing and washing, there should be the proper place for the bathing and washing with the proper privacy. Last one is the water supply. There should be the proper water supply and adequate water supply available at all time in the house. So all these standard has to be followed during the house construction. Next we are going to see about the rural housing. What is rural housing? So this is following the minimum standard. Minimum standard the rural housing is following. So what the standard should be? There should be at least 2 living room, and there should be the 1 veranda, and built up area should not exceed 1/3 of the total area. Next standard that is, there should be the sanitary well, means proper water supply should be there, and there should be the separate kitchen that we have discussed, and there should be the platform for the washing of utensils also, and there should be the insanitary for the keep cattles that the living area of the cattles, that should be the at least 20 feet away from the house. Next standard, that is, the house should provide the sanitary latrines. There should be a sanitary latrine, and the window area should be at least 10% of the floor area, and there should be the adequate arrangement of the disposal of waste and the refuse of the garbages. So these all are standards we have discussed for the rural housing. And the next we will see housing and health, means how the housing is affecting our health. If the more crowded area, means more people are living in the small house, so that can lead to the several type of diseases that can get spread from one individual to another. So that the health they are affecting our health. We will discuss one by one. That respiratory infection, so it can cause respiratory infection that are common cold, tuberculosis, influenza, diphtheria, bronchitis, measles, whooping cough, etc. And some skin infection also it can be caused, that is scabies, ringworm, impetigo, and the leprosy. And the rat infection can also be because of improper disposal of the waste and garbages. So rat breeding can take place, and the disease can take place by the rat infection, that is the plague. Next health aspects due to the housing, that is the arthropods can breed in the, if the proper sanitation is not taking place in the house. So house flies breeding, and the mosquito, fleas and bugs can take breeding in the house, and the accident can also take place in the house. The proportion of the house, and if the housing is not following the proper standards that has been given by the government, so it can cause the accident into the house, and it also the cause for the morbidity and mortality. Means if it is not following if the condition are as substandard, means it is also not following the standards that has been given for the housing, so it can cause the morbidity and mortality in the individual. Next we will see the psychological effect. Psychological effect means if the people living in the densely populated urban, means mainly in the urban areas, so they can get isolated from individual to another individual, so that can lead to the neurosis and the behavior disorder into the individual. Next we will see the overcrowding. What is overcrowding? Means if according to the standard, if the small house is there and the number of family is getting increased, so that means it is getting overcrowded, and it overcrowded in which Situation is means the more number of people is getting in the single house. And some that I have already explained, means the infectious disease can get spread easily, that diseases we have discussed. And the psychological stress also is a cause of overcrowding. They will be unhappy, and that can leads to violence in the individual. Next, we will see the standards for the person room. Means if the one person is there, one room is there, number of living should be the 2 person, and the 2 rooms, means all this is the criteria for the person according to the room. Next, that is the floor space. Floor space, if the 110 square feet area, so 2 person can live over there, and the 90 to 100 square feet, 1.5% person can live over there. And so these all are criteria that for the floor space. A baby under 12 months is not counted. Children between 1 to 10 years counted as a half a unit. Means the 1.5% means if the second person is the year in the 1 to 10 years. Sex separation means the if the one male and one female, that they are above 9 years, so they are not obliged to sleep in the same room. That is known as sex separation. And next we will see the indicators of the housing. Indicators of the housing, first one is physical. Physical means that we have seen the standards: air, light, water, noise, and sewage disposal. So these all are standard has to be followed, means that is the indicator of housing. And the economic indicators, that means cost of building, expenditure of the housing, and rental levels. Third one is social indicator. Social aspects of the housing organized by the United Nations in the 1975. So social indicators has been divided into 3. We will discuss one by one. First one is indicators related to comfort. In the indicators related to comfort, means the house should have the proper thermal comfort, means the wall should not get absorb should not get absorb the heat, and acoustic comfort should be there. So all these indicators for the comfort. And the indicators related to prevention of illness, means the frequency of illness due to inadequate sewage and garbage. If the proper disposal of the sewage and garbage will be there, so there will be the chances of decrease the illness and diseases. And the frequency of insect borne diseases, means the arthropods are being if the arthropods are being taking breed into the house, so that can leads to the illness that can caused by the arthropods or the insect borne diseases. And the third one is indicators related to mental health and the social well-being. So in that, the frequency of suicide in the neighborhoods, means if the overcrowded area is there, so they can get a conflict in between them, so and that can lead to suicide. Next we will see that some public policies has been given for the housing. Approach to public policy on housing is India is indicated in the 5-year plans. And in 1952 a separate Ministry of Work and the Housing was created at the center. Next, the government housing programs consist of 2 categories. First one is the public sector housing, and second one is the social sector housing or social housing scheme. Next we are going to see about the organizations of works and housing. So some organization has been work for the housing. First one is the National Building Organization, NBO. Second one is Hindustan Housing Factory, HHF. And third one is Housing and Urban Development Corporation. Fourth one is the National Building Construction Corporation Limited. So these all are organizations of works for the housing. Next we will discuss some Indian government scheme for the housing. This is integrated subsidized housing scheme for the industrial worker and the economically weaker section and the low group housing scheme, and so these all are schemes have been given by the Indian government for the related to housing. Some schemes, this is minimum need program, this is has been given for the housing for BD workers, housing scheme for the coolies, and housing scheme for the fishermen. Next, this is the same, that is the 1 lakh housing scheme, and the Samagra Awas Yojana, and the 2 million housing program and cluster housing program. So these all are about the housing. This schemes was given for the housing. Pradhan Mantri Gramin Awas Yojana, Pradhan Mantri Awas Yojana, Rajiv Awas Yojana, and Indira Awas Yojana, Jawaharlal Nehru Nutrition Urban Renewal Mission. So these all are the schemes has been given by the Indian government for the better housing. Thank you all. If you people are having any doubts regarding this class, you can ask. I will try my best to clear your doubt. Thank you all.